focusing on you. From your team of experts at Sylvester Comprehensive Cancer Center, South Florida's only National Cancer Institute designated cancer center.
Pancreatic cancer can be an uphill battle for patients. But there is encouraging news when it comes to beating this disease, says Dr. Nipun Merchant, Sylvester's chief of surgical oncology.
Until recently, we really had no chemotherapy that was effective. But as we're starting to learn more about the tumor microenvironment and how we can manipulate it and reprogram it to make chemotherapy and immunotherapy more effective, these are the things that are starting to happen now based on a lot of the research that we're doing here.
At Sylvester, each pancreatic cancer patient's tumor is genetically tested. This allows doctors to create novel targeted therapies to attack the tumor for the best possible outcome.
We really look for other mutations in the tumor, and if we have targeted therapies that we can use against those mutations, then that becomes even more effective types of treatment.
Sylvester's research uncovered a certain mutation in 5 to 7% of patients.
We actually were the first people in the world to describe that if you have that mutation, certain patients are going to be highly responsive to immunotherapy with 2 different immunotherapy drugs. In fact, we have a few patients now with advanced pancreas cancer that were refractory to every single type of therapy who are now cured of their pancreas cancer.
Sylvester's expert multidisciplinary approach ensures each patient receives a personalized treatment plan.
It's not just a standard treatment for every patient and see will it work or will it not work. As we discuss every patient, we review every scan, we review every pathology report, we review every genetic test, and we come up with a plan as a team as to what the best approach for that patient will be.
Dr. Merchant says when it comes to pancreatic cancer, it's important to keep these 3 things in mind.
Number 1, first and foremost, it's not a death sentence. We have so many more options now for treatment. Number 2, I think it's critical coming to a place that sees a high volume of these patients and that has a multidisciplinary team. And number 3, being at a center that is doing a lot of research in this, because this is the only way we're going to make any advances.